Respected teachers and my dear colleagues, after a hectic load of academic pressure, we will now go to the lighter aspect of the management, recent trends in the management of endometriosis. We can have minimal endometriosis or even extensive endometriosis and sometimes severe endometriosis, so that we won't be able to do anything even after surgical treatment, and the patient continues with the problems. We will have a just brush upon the important things and then go to the important aspect of the latest management. It is an estrogen-dependent disease, frequently resulting in substantial morbidity, severe pelvic pain, multiple surgeries, and impaired fertility. Clinically, defined as the presence of endometrial-like tissue found outside the uterus and resulting in sustained inflammatory reaction. As you are aware, the sites of endometriosis are so much, and you are more bothered about sites which will stand in the way of fertility. We have so much of the investigations, but usually after clinical examinations, we will have to do a transvaginal ultrasound. It can detect ovarian endometriotic cyst containing altered blood. MRI of the pelvis may be required in many cases. And of course, the gold standard in the diagnosis is laparoscopy. Ovarian endometriosis can be sometimes very difficult, and even after drainage, it can linger with problems. We'll just touch on the medical management and go to the recent advances. The most commonly used ones are the combined oral contraceptive pills, levonorgestrel intrauterine system, Mirena, the gonadotropin releasing hormone analogs, GnRHa, and progestogens, progesterone derivatives. All these treatment modalities have got limitations. It will definitely bring down the symptoms, but later on they recur. As it was mentioned by the previous speaker, that aromatase inhibitors such as Arimidex and letrozole have no much of a role in the modern management, but many clinicians still use it. And they control the symptoms to a great extent, and most of the time we require that. But we are also sure that it won't eliminate the symptoms. Analgesic drugs are usually the essential part of the medical treatment. When the patient comes with pain, simple drugs like paracetamol, codeine, non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, mefenamic acid, and diclofenac, we all try with much or less effect, but we use it. The principle in using aromatase inhibitors, although they are going out of the treatment arena, we should know that endometriotic implants express aromatase and consequently generate estrogen for maintaining the viability of the growth. Aromatase inhibitors inhibit local estrogen production in endometriotic implants, ovaries, brain, and in adipose tissue, and reduce the endometriosis associated pain to a great extent. And this is very important when you use this agent. Progestins inhibit the growth of lesions by a different mechanism by inducing desvisualization followed by atrophy of endometrial tissue. Medroxyprogesterone acetate is effective against pain and suppresses endometrial growth in the form of oral and injectable preparations. Mirena, as it is very evident, it is effective in reducing the pain and is much may be considered as an alternative for hysterectomy for adenomyosis patients. And menorrhagia gradually decreases, cycle by cycle, and pain also decreases along with that. NSAIDs we have already mentioned, and although the effect is not to great extent, the side effects are of acceptable levels. Gonadotropin releasing hormone agonist produces hypogonadotrophic hypogonadal state through downregulation of the pituitary gland. Pain relief is effective and reduces progression of the disease. As it is clear, there is no much of an improvement of the fertility, and postoperative treatment reduces pelvic vascularity, and intraoperative blood loss is also limited with that. It was also mentioned by my previous speaker about the alternate therapy, but there are few things which has not mentioned. Definitely herbal medicines are available now. When there is no other medicine to be used, people go after this. And physical therapy can also do a lot. Diet and nutrition, when we have nothing in the hand, we speak about diet and nutrition. Acupuncture, of which I have no knowledge, but still people believe that it has got some effect on pain relief. When the patient can be hypnotized with no medicine, that can also be considered. Chinese have got so much of the traditional medicine which are used in infertility, endometriosis, and our most important gynecological conditions. And when you use growth factor inhibitors, they also produce some type of effect which will inhibit the growth. And all these factors will improve the well-being of the patient, which is all the more important. And there comes the most modern treatment in gene therapy for endometriosis. We are happy that, and also lucky to say that, Kerala is now starting the first project in whole of India in RCC next month, and there is gene therapy for cancer patients. But this is equally effective in endometriosis patients. It is a new approach to the treatment of an inherited or acquired diseases by introducing nucleic acid into the cells. The principle of gene therapy is compensating the gene defects or altering gene expression to prevent, stop, and reverse the pathological changes. It was shown that introduction of a functional copy of a gene into a patient's cell can totally cure the disease. And we should know the helical structure of the chromosomes, and we will now understand the methods connected with that by simple mechanisms. And as we are familiar with the ICSI process, this is only a little advanced process when compared to ICSI. The insertion of genetic material into the human cells for the treatment of disorder can be done. There are two methods. One is an in vivo method. No cells are removed from the patient's body. Instead, vectors are used to deliver the desired gene to the cells of the patient's body by injection into a vein, which will be made clear in the next slide. In in vitro method, the cells from the blood or bone marrow are removed and grown in the lab. They are now exposed to virus carrying desired gene. The virus enters the cells and the desired gene becomes part of the DNA of the cell. And these cells are grown in the lab, then returned to the patient by injection into a vein. The faulty gene that causes the specific disease must be identified is the most important one, and the location of the affected cells must also be pinpointed. Gene therapy we have already mentioned. We'll just show in 2 slides so that we can easily understand the helical DNA. And we need such pleasant phases of the treatment after pregnancy. Single gene defect can be corrected by this gene therapy. And gene therapy becomes simple, especially for gynecologists. And it is very new now, but it can easily solve many of the problems connected with infertility and endometriosis. Treatment or starting with the cells removed from the patient cells, or it can be directly connected to the virus which is acting as a vector and altered virus will be injected back into the patient's blood, and that starts the treatment. And this virus is mixed with the normal cells of the person, and the treatment is by the cells getting a new genotype by this action. And the mixture is injected back to the patient for treatment. And gene therapy is gaining momentum now, and these cells are either destroy the tumor or produce necessary proteins and hormones for the treatment. And even brain metastasis can be treated by this. And all these factors will tell that we are going through a very important era where the gynecologists can be saved from most of the problems associated with the management of endometriosis. This is almost similar to the ICSI. You collect the cell is being sucked with the forceps by a vacuum, and with a very sharp needle, you penetrate the cell and introduce the gene. And you need a healthy version of the gene which must be available. And the healthy gene is to be delivered to the cells. That is the basic mechanism. And gene therapy is used to correct the genotype of the patient. And this can spontaneously correct the pathology of the patient in total. And there is another intriguing factor in a patient with endometriosis. When the patient has got endometriosis and the diagnosis has already been made, the most important factor is the pain associated with the endometriosis, deep pelvic pain. And so many research has been done on deep pelvic pain. And even if you remove the endometriotic deposits, patient continues the pain. And this has been found to be as a result of a factor and connected with angiogenesis. Inhibition of angiogenesis and ectopic angiogenesis is known to play an important role in endometriosis. And in this aspect, he used angiostatin, which is used to inhibit the endometriosis-associated angiogenesis. And another aspect which is coming up is the immunotherapy. And stimulation of the immune response to the tumor cells is the basis of this treatment. When the patient has got immunomodulation, and that will be accelerated by this process, and to reach the goal, genes encoding the tumor specific antigens, co-stimulatory molecules, and or even inflammatory cytokines, and should be delivered to the target tissue. And this would render the organ to be more immunogenic, and the patient becomes more competent enough to handle the disease process of endometriosis. And we have already mentioned about the pain. There is a factor which is connected with the pain of endometriosis, and the treatment of pain is mainly connected to the nerve growth factor. And nerve growth factor is continuously being elaborated even in the beginning of endometriosis. Even with minimal endometriosis, the pain factor is being alerted. And this nerve growth factor is responsible for the pain in endometriosis. And hyperalgesia in deep adenomyotic nodules could be explained by this NGF. And we are now getting ready with anti-NGF antibodies to block the NGF activity so that the pain comes to a standstill and you can treat the patient later on so that the patient comfort is being brought and the patient will feel that she is getting relief. And in conclusion, endometriosis is a potentially chronic condition which may have serious impact on the woman's quality of life and fertility. A multidisciplinary approach in management is mandatory in effective clinical improvement of the patient. And of course, gene therapy could open up many channels in the treatment of this clinical enigma. Thank you very much.